What we know about COVID-19 is evolving every day, and we've received hundreds of questions from you. And to help answer some of them is our 9Health expert, Dr. Payal Kohli. Good morning, Dr. Kohli. Thanks again for joining me. So the first question comes from a viewer who's asking about wearing masks. A person says, we've been wearing masks to cover our mouth and our nose. This viewer asked, should we worry about covering our ears?
Good morning, Natasha. So far there has been absolutely no scientific evidence that the virus can actually enter your body through your ears. It's mainly a respiratory virus, so we know that the portals are the nose and the mouth. There are also reports from the American Academy of Ophthalmology that suggest that the eyes could be a potential portal. So if respiratory droplets come into direct contact with the eyes, there's some reports that that may actually increase your risk of infection. So more than the ears, I really think we need to worry about our eyes. And again, keep that distance so that the likelihood of those droplets getting in through any of those portals is very low.
Our second question comes from Richard in Glenwood Springs. He asks, do low temperatures kill the virus? And if so, what temperature?
So, Richard, I wish it did, because the last couple of days have been really cold and snowy. But unfortunately, there's no evidence that low temperatures kill the virus. In fact, what we do know about this virus is that it actually spreads more efficiently in cold and dry temperatures compared to hot and humid temperatures. Now, we do know that the opposite is true, that extremes of heat, greater than 150 degrees Fahrenheit, can inactivate or kill the virus, but cold temperatures don't seem to have that same sort of effect.
Okay, interesting. And finally, we're getting closer to summertime. Someone asked, what are the ramifications of opening pools by the end of May?
I'm glad that somebody asked this, because I've seen people heading to hot tubs and things like that. And in my opinion, it's a terrible idea for a few reasons. The first is that when we're in a pool, we tend to be close together, so social distancing is very hard. The second is that you can actually have a lot of saliva, respiratory droplets get into the water itself when you're in the pool. And we don't know enough about this virus at this point to know how long those droplets are going to persist in the water, how infectious they are, and just how quickly they can spread to others. So it would be my strong recommendation to avoid any sort of community pools, hot tubs, anything like that, because we just don't know enough about this virus and how it spreads to allow for those types of recreational activities.
Maybe some people might say the chlorine in the pool might kill the virus. Any guidance on that?
Chlorine has not been studied directly on the virus itself, but we do know that chlorine is usually more effective against bacteria than viruses. And it may have some possibility of maybe inactivating the virus. We just don't know the answer to that yet, but I wouldn't hang my hat on it, because this virus doesn't seem to follow the rules.
Yeah, that's for sure. You don't want to risk it. All right, Dr. Kohli, thank you so much. Nice to see you.